I'm doing the abdominal assessment. First thing I'm going to do is I'm going to give my patient some privacy. I'm going to ask him to lay on his back so I can view his belly. Then we're going to go into the inspection. So I'm going to lift the shirt up a little bit. And we are going to look at the belly. So we're going to look and see if it's flat or rounded. So his is a little rounded, but flat for the majority. Then we're going to see if there's any distension. So there's no distension, but signs of distension would mean like ascites or an obstruction. We're going to look and see if his umbilicus is symmetrical, and his is. If it were asymmetrical, that would mean such things like hernia or a tumor. And then we're going to look at the skin. So the only thing with the skin I see is stretch marks on the lower quadrants, but you could look for rashes or lesions. You want to look at the color for like jaundice or some bruising. And then for like scars, you can look at for previous traumas or infections. So next I'm going to listen to it. You want to listen to it before touching it because you don't want to alter bowel sounds. I'm going to listen to each quadrant for 5 to 30 seconds. You want to hear gurgles, but if you don't hear anything, you want to listen to it for 5 minutes. He has bowel sounds times 4. So if there are no bowel sounds, you want to be concerned for possible obstruction. And then you want to listen for the Brutes or friction rubs, which you would be concerned for renal artery stenosis. So next we're going to go to percussion. We are going to percuss each quadrant. So for percussion, you want to look for the dullness. So if you have shifting dullness or fluid wave, you want to be concerned for ascites. If you have excessive movement, you want to be concerned for a bowel obstruction or air-filled loops. And then if you feel dullness where you expect movement, it could be an enlarged liver, spleen, or mass. So next we're going to go to the palpation. I'm going to ask my patient first if he's in any pain before I go pressing into his belly. Are you in any pain?
No.
Okay. So I'm going to start in the lower right quadrant and I'm going to go clockwise. If he has pain in his right lower quadrant, you want to be concerned for appendicitis. Right upper quadrant, if there's pain, you want to be concerned for cholecystitis. No pain there. And then for the left lower quadrant, if there's pain there, you would be concerned for diverticulitis. While I'm doing the abdominal palpation, you want to look at your patient and see if they're wincing or they start to guard for their belly, because there could be new onset pain during that. Also, during palpation, you can ask your patient when their last bowel movement was and if it was normal or if there was any blood or anything. I'm going to thank my patient for letting me do this abdominal assessment on him, and that's it.